If it seems to you that more people you're running into are mentioning that they are just getting back to work or life in general after coming down with the COVID virus, or they tested positive for it, you're right. As might have been expected, the holiday season stretch from Thanksgiving through New Year's prompted an uptick in cases. Nothing like the bad old days of 2020 or 2021, but more than what was going on last summer. The state's health department reported earlier this month that 59 people had been hospitalized for COVID in Vermont in the previous week, the highest number the state has reported since January of 2023. And the University of Vermont Medical Center announced a partial return to staff masking in patient care settings. Is this an unsurprising blip on the general downward trend of hospital cases, or a new variant that spells trouble? To learn more about what's happening on the COVID front, we turn to Dr. Trey Dobson, the Chief Medical Officer at the Southwestern Vermont Medical Center in Bennington. He's also an emergency medicine physician with Dartmouth-Hitchcock Health.
One of the difficulties we have, and I think most of the folks watching this will understand, is our surveillance for infection is now, nothing compared to what it was in 2021, where testing was all centralized and the reporting of the testing was centralized. Now, vast majority of the testing is done at home. And then a lot of people don't even test. They have the symptoms, they realize it's a respiratory infection of some type. It's either a cold virus, it's influenza, it's COVID, it's RSV, and they don't even go through those processes. They just try to wear a mask and stay away from others. And actually, that's what, as long as someone is healthy and not experiencing breathing problems, that's what a lot of doctors would recommend. Stay at home, wear a mask if you're out in public. Let's get through this. If you can test, it does help because it gives you a little bit more of a defined regimen on what to do and how long to be out. But you are right. There is most likely an increase in positive tests and actually infections. We just don't have a great way to measure it. We do look at things like wastewater, which also has its problems, but wastewater, starting in mid-December, really showed increases in COVID-19, likely almost, assuredly corresponding with infections. Andrew, what we do look at and care about most in 2024 as opposed to 2020 and 2021 is hospitalizations, because that just shows the severity. And actually, hospitalizations have increased as would be predicted in the winter months, but not to the same level, in fact, of last year. Very similar to last year, but not quite as high, and certainly not as high as January of 2022, when there was 400% more hospitalizations, 300 to 400% more hospitalizations than there are now. And that's because it's possible that the virus itself is a little bit less virulent, but it's more probable that our immune systems are better able to handle it. Most people have been vaccinated and have also been infected. So our immune system responds. We get a fever, we feel bad, we may have a slight cough, but all of those breathing problems that were, frankly, leading to hospitalizations and many deaths have decreased. Those that are elderly and those that, I shouldn't even say elderly, those that are above the age of 65 and those that have medical conditions do remain at risk. And those are the vast majority of people who are hospitalized with the virus. Right now, if we look locally, we know the numbers are high. We know it's high because people are calling out sick from work and testing at home. But hospitalizations in our area have not increased past years that we've seen in 2023, for example.
Might this uptick, if that's what it is, be explainable by the fact that the holiday season people get together and gather in groups more than may have been the case earlier, earlier in 2023?
Absolutely. Saying that that people were visiting and close together has got to lead to more infections, and the fact that it's winter and people are closer together. But it's hard. We know those are correlated. We can't quite say that there's causation there yet. And the reason is our numbers get high in the summer as well, and we're not having holiday visits, and we're not having cold weather. So it's not a seasonal virus yet. People say that, but it's not a seasonal virus yet. It probably will be We were thinking it would be by 2024. It may take another couple of years to develop that type of pattern. Seasonality is not just related to cold or people being congregated close together over the holidays. It's also related to how long our immune system will fight off the disease. And whereas most colds and some other respiratory viruses are 6 months to a year, which kind of gives, that annual type pattern, COVID seems to be a little bit less than that. So people can be reinfected within a few months, let's say 90 to 120 days, as opposed to the, 8 months to a year that you see from other respiratory viruses.
Yeah, that's another thing. I talked to a couple of people who told me this is their second or third time having COVID. I mean, I guess I had thought 2 or 3 years ago, back in the beginning of all of this, that well, if you had it once, you develop an immunity to it, and you kind of got your get out of jail card at that point. But apparently not the case.
It's not the case, and we really shouldn't be surprised. It is coronavirus. The other coronaviruses, the other three coronaviruses, are all cold viruses, and people don't get immune to colds. We get colds every year almost, but there is a period with cold viruses where you don't get reinfected. You get the cold, and then you don't get it again for 6 months to a year. It seems like COVID might be a little bit quicker than that, and that's the point. I do want to highlight, though, I've been hearing the fear and anxiety and people saying there's so much COVID going around, they're worried. But, think about again what I said at the beginning of our discussion. The hospitalizations aren't really increasing at a rate that would be over and above what would be expected. And that is because the disease itself is not affecting people, as bad as it was. Yes, it's hard. You miss work, you have fever, you have a cough, you might be even in bed for a couple of days. But the good news is the virus was killing lots of people in 2020, and it's not doing that today. There are deaths attributed to COVID for sure, and there are reasons to protect yourself. You certainly don't want to be spreading it around to those that are vulnerable. But our fear should be abated a little bit as we see that it's not the same virus it was when it first surfaced.
Now, is this a medically different variant from what we were seeing in 22 or 23? I mean, this isn't Omicron or Delta or anything. This is a different strain of the virus that is in play at the moment.
That's right, the JN1. It is a different strain. We expect it to continue to mutate. There's always the fear that it changes into a virus that's more virulent, and the word virulent means more, basically more deadly or more causing more sickness. But it's not doing that so far. Most of the indications are it's the same or even less, but it does evade our immune system better. So the virus gets better at infecting people, but so far it really hasn't gotten better at hurting people. And you could, philosophize here a little bit, if you'll allow me, and say the virus doesn't want to knock people out. It just wants to reproduce itself. And so if it kills the host, then it can't reproduce itself very well. Now that's just kind of me being philosophical and not really how the virus acts, because the virus doesn't think, it just mutates and
So,
reproduces.
are we looking at a situation where, basically COVID is going to be, an endemic problem where it's not like we're going to ever see the end of it completely, but it's going to be like, let's say, the flu or any strand of flu, and it's just going to be part of life from now on.
Yeah, that's right. So by most definitions, COVID is already endemic now. It is not seasonal. That's just the difference. And it will likely be seasonal, but it hasn't developed that pattern. Viruses have come about. It is probable that one of the cold viruses that circulates, that all of us have had, was the 1917, 1918 influenza virus that really wasn't an influenza virus, was probably a coronavirus that eventually our immunity built up, so it's not, it doesn't affect us as much. It certainly nags at us and causes us to miss work and school with a cold. That's, by the way, that's not been proven. That's just a hypothesis that seems plausible. So yes, COVID is now endemic and not yet seasonal, but likely will be.
And just finally, I just wondered on the vaccine front. I was looking at the numbers, and if I've understood them correctly, only about 17% of residents in Benton County have gotten the latest vaccines. Uh, I guess, first of all, does that sound right to you? Or, I mean, that's what I think I saw on the Department of Health's website yesterday. Um, and I guess part two of that question would be, it would be a good idea, in your opinion, that folks kept up with the vaccines or new generations of vaccines as they are available.
Yeah, absolutely. There are many reasons why the vaccination rate is much lower. I'll just name a few. You have to pay for it, so it's expensive if you don't have insurance. And if you do have insurance, there's still the difficulties with submitting information to insurance. By the way, when I got mine, there was no questions asked. They gave me the injection back in the fall and billed my insurance, and I really didn't hear, anything else about it. But that's not everyone's case. So that's one reason. The second reason is it's not as abundant as it was. Not as many places, offer the vaccine at convenient times. We had drive-up vaccination at one point. That no longer exists, so it makes it harder for people to get it. Unfortunately, there is a anti-vaccine as well as just a fear of vaccines that has developed in this country out of the COVID pandemic and distrust and misinformation campaigns, and that's really unfortunate. And then there's a host of other reasons, including the fact that people are like, "Hey, I've gotten COVID a couple times now, and I've been okay," and they're correct. So they decide it's not worth it to them. But let me just change this around and say, who wants to be sick? Who wants to miss work? Who wants to pass it on to a loved one? And being vaccinated decreases the chances of all that. Yes, people that are vaccinated get the virus, no doubt, and sometimes they feel poorly. But it is clear that they feel less poorly, that they miss less school, that they miss less work, that they transmit it less, and they get hospitalized less if they are vaccinated. So it appears that right now it's going to still be an annual recommendation. So if you didn't get your fall booster, please do that. Even if you've been infected, wait about 90 to 120 days after an infection before you get the booster, and then make it a part of your annual vaccination and health maintenance schedule.
So don't throw away the box of face masks just yet, huh?
Well, that's right. You bring up something else too. I'm glad to see that people can still travel with a mask or be at work with a mask and feel that that's the right thing to do and not worry about, the repercussions of doing so. In many countries in Asia and in other parts of the world have done this for a decade during flu season, during respiratory virus season, and say, hey, I might not wear a mask every day, but I'm not going to travel around a bunch of people in the winter who are coughing without a mask on because I don't want to be sick. And I'm glad to see that helps. I personally don't wear a mask often. I will wear it, of course, around patients when they're ill or exhibiting symptoms. But I've gotten to the point where when I travel, I like to wear a mask just so I can enjoy my vacation and not get sick.
Yeah, yeah. It's. I guess I remember thinking a couple of years ago, oh well, by this point, this will all be stuff for the history books, but not really. But I guess yeah, like you say, we're not seeing a return to the bad old days of 2020 or 2021, so that's good. Now, just do you expect? This is probably a dangerous question. Do, do you expect that this uptick or upsurge or whatever it is that may be occurring around the holiday season will play itself out fairly quickly, and the numbers will kind of drop back down again to what they were earlier in 23, or is it impossible to say?
Well, it's impossible to say, but I do love my crystal ball. And I would say it looks like we're going to see it decline again, which is what we've seen almost every year around this time, and then pick back up in the late spring. Now, again, I did mention that it may develop a seasonal pattern. And if that's the case, we may see our first spring with a lull and not pick back up again until the fall. Unfortunately, it's as I mentioned earlier, it's whether or not a virus becomes seasonal is not just related to the virus, it's related to our response. And if we're able to be reinfected on more of a 6-month time frame, then that's the type of time frame we may see as far as peaks go. Now, it gets very complicated if there's a scientist out there or a physician or someone who is a computer modeler. They will know that not everybody gets infected every 6 months. It's evened out. So why would it not be evened out? And that's how viruses become seasonal. It goes back to what you were saying. Even though people might get infected at different parts of the year, the bulk are going to get infected when they're close together, and that in the northern hemisphere is in that November through March timeframe. Some of the things that we've always said in the pandemic, they hold true, and they hold true for things other than COVID, and that is wash your hands often. It's very important. We know that some huge percentage of diseases are spread through unwashed hands. I know that if you're coughing and you don't feel well, you should not be at work, you should not be at school, and you should wear a mask when you're around others. Get through it, and you hope that they would do the same with you. And finally, if you're at risk and you're having difficulty breathing, you need to be seen, and there are medications if you have COVID-19 or even other illnesses that you may be eligible for. So see your doctor, see your advanced practice provider if you're having those problems. If you're not having those problems, if you just feel bad, you have a fever and a slight cough, you don't need to go in and see someone in the medical profession. You can stay at home and just isolate yourself or stay away from others until you feel better.
So maybe don't lose those face masks just yet. And if you haven't gotten the latest vaccine booster, that might be something worth considering. We may all be finished with COVID, but unfortunately, the virus isn't finished with us. For the GNAT-TV News Project, I'm Andrew McKeever.